Welcome to Healthful Horizons, your gateway to a healthier, more informed life. Before we embark on today's enlightening video journey, imagine this: with a simple click on the links in the description below, you're not just watching, you're actively shaping the future of health education. By exploring the products we recommend, you're investing in your well-being while championing the creation of more dynamic, free content for all. Your support is the heartbeat of our mission, fueling our passion to deliver transformative insights straight to you. So, let's step into this world of wellness together, where every choice you make sparks a brighter, healthier tomorrow. Thank you for being a beacon of support on this incredible journey. Hit that subscribe button to become part of our informed community and gain access to exclusive content designed to elevate your well-being. Now, let's jump into today's enlightening video. Get ready to dive into the world of leukemia. Join us as we uncover the mysteries of this common yet complex cancer, and explore the latest treatments that are changing lives. Don't miss out on the chance to learn, be inspired, and make a difference. Stay tuned for a journey that will touch your heart and ignite your curiosity. Leukemia, the fight for life begins now. Subscribe and be part of the movement. What is leukemia? Leukemia is a term for cancers of the blood cells. Leukemia starts in blood-forming tissues such as the bone marrow. Your bone marrow makes the cells which will develop into white blood cells, red blood cells, and platelets. Each type of cell has a different job. White blood cells help your body fight infection. Red blood cells deliver oxygen from your lungs to your tissues and organs. Platelets help form clots to stop bleeding. When you have leukemia, your bone marrow makes large numbers of abnormal cells. This problem most often happens with white blood cells. These abnormal cells build up in your bone marrow and blood. They crowd out the healthy blood cells and make it hard for your cells and blood to do their work. What are the types of leukemia? There are different types of leukemia. Which type of leukemia you have depends on the type of blood cell that becomes cancer and whether it grows quickly or slowly. The type of blood cell could be lymphocytes, a type of white blood cell. Myeloid cells, immature cells that become white blood cells, red blood cells, or platelets. The different types can grow quickly or slowly. Acute leukemia is fast-growing. It usually gets worse quickly if it's not treated. Chronic leukemia is slow-growing. It usually gets worse over a longer period of time. The main types of leukemia are acute lymphocytic leukemia, ALL, which is the most common type of cancer in children. It can also affect adults. Acute myeloid leukemia, AML, which is more common in older adults but can also affect children. Chronic lymphocytic leukemia, CLL, which is one of the most common types of leukemia in adults. It often occurs during or after middle age. Chronic myeloid leukemia, CML, which usually occurs in adults during or after middle age. What causes leukemia? Leukemia happens when there are changes in the genetic material, DNA, in bone marrow cells. The cause of these genetic changes is unknown. Who is at risk for leukemia? For the specific types, there are different factors which can raise your risk of getting that type. Overall, your risk of leukemia goes up as you age. It is most common over age 60. What are the symptoms of leukemia? Some of the symptoms of leukemia may include feeling tired, fever or night sweats, easy bruising or bleeding, weight loss or loss of appetite, PTK, which are tiny red dots under the skin. PTK are formed when tiny blood vessels called capillaries break open. When these blood vessels break, blood leaks into your skin. Other leukemia symptoms can be different from type to type. Chronic leukemia may not cause symptoms at first. How is leukemia diagnosed? Your healthcare provider may use many tools to diagnose leukemia. A physical exam. A medical history. Blood tests, such as a complete blood count, CBC. Bone marrow tests. There are two main types, bone marrow aspiration and bone marrow biopsy. Both tests involve removing a sample of bone marrow and bone. The samples are sent to a lab for testing. Genetic tests to look for gene and chromosome changes. Once the provider makes a diagnosis, there may be additional tests to see whether the cancer has spread. These include imaging tests and a lumbar puncture, which is a procedure to collect and test cerebrospinal fluid, CSF. What are the treatments for leukemia? The treatments for leukemia depend on which type you have, how severe the leukemia is, your age, your overall health, and other factors. Some possible treatments might include chemotherapy, radiation therapy, chemotherapy with stem cell transplant, targeted therapy, which uses drugs or other substances that attack specific cancer cells with less harm to normal cells. Thank you for joining us today to learn about leukemia. Remember, knowledge is power, and together, we can raise awareness and support those affected by this condition. Stay informed, stay healthy, and take care. Until next time. Disclaimer: the information provided in this video is for general informational purposes only. It is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay seeking it because of information provided here. Thank you for joining us on this journey of health and wellness discovery. We hope you found this video insightful and empowering. To continue learning and growing together, don't forget to hit that subscribe button and ring the notification bell so you never miss out on our latest content.